The global COVID-19 pandemic is not over. We are currently seeing increasing COVID-19 case notification rates and an increasing trend in hospital and ICU admissions in several countries, mainly driven by the BA.5 sublineage of Omicron. Today, 2 publications on vaccinations and surveillance are being released by ECDC. The first covers preliminary public health considerations for COVID-19 vaccination strategies in the second half of 2022. And the second outlines operational considerations for respiratory virus surveillance in Europe. Vaccinations and surveillance remain 2 of the most important tools for member states in their effort to prevent and control COVID-19. Both documents provide guidance how member states can prepare for autumn. ECDC strongly encourages adults 60 years and older to get a second booster dose as soon as possible. These could be administered at least 4 months after the previous one, with a focus on people who received the previous booster more than 6 months ago. Those that are immunocompromised and medically vulnerable of any age will also need a second booster dose. In anticipation of an increase of COVID-19 infections in the autumn and winter seasons, countries should plan the rollout of further additional booster doses to be administered to population groups at risk of severe disease in early autumn, possibly combining campaigns for vaccination against COVID-19 and influenza. Effective surveillance systems are the basis of information for action, and as such, ECDC has collaborated with the World Health Organization, the Regional Office for Europe, to address the urgent need to develop and sustain resilient surveillance systems for influenza, COVID-19, and other respiratory infections. Effective surveillance systems can monitor the spread and intensity of respiratory viruses to guide control measures and mitigate their impact. They include the laboratory capacity to test systematically collected samples and sequence them to detect changes in the circulating viruses early. These systems will also be important in the event of future pandemics. With the start of a new wave of COVID-19 infections, countries should plan for upscaling of testing capacity, influenza viruses and SARS-CoV-2 in response to any new strain of influenza or SARS-CoV-2 variants of concern. I am aware that a significant effort from public health authorities and society at large will be required to address these challenges. But now, at the beginning of a new wave, is the time to make the extra effort. There is an urgent need to establish robust, integrated surveillance systems that are sustainable and resilient should a new pandemic arrive, and the availability of several safe and effective vaccines means every single COVID-19 infection prevented now is a potential life saved. The message today is: be prepared and plan ahead. We need to strengthen the surveillance of respiratory diseases and increase vaccine uptake. And we must work in this together.